is Christian Lindmeier, and I'm welcoming you to today's.
I'm pleased that more leaders are now joining the call for a pandemic treaty, which would be a generational commitment to keeping the world safe. There will always be new pathogens with pandemic potential. It's not a matter of if, but when.
Koja, Minister of Health from the Republic of...
Health and care workers are at the forefront of the response to the COVID-19 pandemic, and they play the critical role in protecting us all. Far too many health and care workers have died in the pandemic. Millions have been infected, and the pandemic has taken a huge toll on their physical and mental health, with devastating effects on their families and communities. Anxiety, depression, insomnia, stress have all increased. Exhaustion is commonplace, and there have been cases of stigma and even abuse. I give thanks to those that have stood up in one of humanity's toughest periods.
Is provided in the 6 official languages.
There is still a serious challenge on vaccine equity and availability. Last week, I made an urgent request to countries with doses of vaccines that have to WHO emergency use listing to share 10 million doses immediately with COVAX. The extra 10 million doses would be an urgent stopgap measure so that 20 countries which are ready but haven't got the supply needed to start vaccinating their health workers and older people could begin before the 100th day, 10 April. I also requested manufacturers to help ensure that the countries that step up can rapidly donate those doses. This challenge has been heard, but we're yet to receive commitments for these doses.
Director General. Dr. Mike Ryan, Executive.
I know this is a challenging time for many countries as cases and hospitalizations are spiking. But conversely, it's when cases are spiking that it's the most important time to share vaccines equitably and protect health workers and at-risk communities. The race is on to get vaccines to those places and groups where they can have the greatest impact.
Second country in total number of victims.
Indeed, there is a very serious situation going on in Brazil right now, where we have a number of states that are in critical condition. I understand that the Brazilian Ministry of Health has stated that 6 states are in critical condition, and nationwide, the hospitals are overwhelmed, with most ICUs at over 90% capacity. And we're aware of a recent survey that was carried out by the National Council of Health Secretaries, finding that more than 6,000 people were waiting for an ICU bed, 6,000 people with COVID-19 waiting for an ICU bed. So indeed, there is a critical situation there. The challenges are many in terms of increased transmissibility with this P1 variant that has been detected, that is circulating in the country. If you have increased transmission or a more transmissible virus, you will have more cases, which can overwhelm a health system that is already overwhelmed.
Remarks. Thank you all for your participation. We will be sending